I moved to Nottingham initially to pursue my training in respiratory medicine and general internal medicine because I happen to be a medical doctor. And then I was introduced to Professor Ian Hall, and I was very interested in doing my PhD with him. Ian introduced me to physicists at Sir Peter Mansfield Imaging Centre, and they were also very welcoming. They quite understood that I'm not a physicist, so I wouldn't know about the technology, but what I brought to the table was its translational aspect and how we could use it in clinical setting. For me, the most important tip is to pick your supervisor correctly, because it has to be someone who understands you, who will support you. And I think it's also important to be passionate about the subject that you're researching. I've finished my third year of PhD and I'm currently in the writing period really, and I hope to submit my PhD within the next few weeks. I've loved doing my PhD at University of Nottingham. It's been brilliant doing it with physicists because I'm a clinician and they have a completely different mindset to mine. Their priorities are different, and while at times it can be challenging, it's also very interesting. I have also had the opportunity to present my findings at international conferences such as the European Respiratory Society Congress, as well as national conferences such as the British Thoracic Society Conference, and I have also been an invited speaker at some of these conferences. So it's been a brilliant experience. I intend to pursue a career in clinical academia. To do this PhD, I was successful in obtaining a clinical research fellow post, and that was part of my PhD for the first 3 years. On the basis of my PhD and its strengths, I was also successful in my application for an academic clinical lecturer post, and as of August, I've been a clinical assistant professor in respiratory medicine at University of Nottingham. So this is an extremely important step in my career, and University of Nottingham has been extremely supportive.